All right, so this video is about sciatica. We're going to delve into this today. Those of you that have sciatic symptoms and have been unable to find relief despite doctor visits, physical therapy appointments, whatnot, this might be something you're interested in. Seeing this quite a bit lately. It's summertime, people are getting on their bikes, they're starting to hike, they're starting to play some softball, basketball, volleyball, and this new activity that hasn't been there for several months is really starting to expose some weaknesses in their spine and core, and it's leading to sciatic symptoms. So just a brief overview of the anatomy here of where your sciatic nerve inhibits and controls. So if you take a look at this here, so your sciatic nerve is innervated here in the lumbar spine, as you can see. So it's innervated here, then it travels through the femoral nerve root, okay, through the pelvis, and all the way down the leg, bringing nerve supply through the leg, through the toes. So if you take a look at where that's innervated, where that starts out here, the origin, lumbar spine. Now let's take a look at the lumbar spine. So here's the front of the lumbar spine. So this is what most people think of as the core. And when most people think of core, they think of these six-pack muscles here, which is your rectus abdominis. But it's actually the deep layers of the core that provide the stability in the spine to prevent things like sciatica from occurring. So if you take a look at here, this muscle system here, the core system, provides a nice girdle, and that's done by these deep muscle groups, intrinsic muscle groups that are around the spine. So in this case, you've got the transverse abdominis, and not pictured here, you also have the interior obliques. And then on the other side, okay, we've got our lumbar extensors here, pelvic stabilizers like the glutes, the multifidus. You've got your quadratus lumborum in here, and plus your intertransversary muscles, your rotatories, all these deep intrinsic muscles really protect the spine. So what happens in the case of sciatica or things like sciatica? So sciatica generally is a condition of spinal instability. Okay, there's also stenosis of the spine, where you got narrowing of the root canal, and that's a different issue. But in most cases, you're gonna see instability in the spine here, and this is from a number of things: poor movement strategy, poor posture, unfavorable ergonomic workloads, sitting at a desk for too long, these types of things. But basically, what happens is you get in these sections here. So obviously, quick anatomy run through here. So here you've got the actual vertebral. The vertebrae, and then on the inside you've got the discs here. So you've got the vertebrae, the discs, and then the middle of the vertebrae actually acts as a shock absorber. It's a sponge-like system. It absorbs fluid that escapes from the disc to maintain the spine's ability to absorb shock and to be mobile without having to worry about disc fluid popping through the annulus. So as you see here, this nerve travels along the spine, and a lot of times with your sciatica, we get instability in segments. Okay, so maybe we get 2 or 3 of these vertebrae that get locked, so they all move together instead of moving segmentally in a stable manner, which creates instability above and below. So for example, let's say this is L3, 4, 5 here. Okay, so let's say this person has a poor bend strategy, and they maybe got a block here in L2, 3, 4, and that creates a hinge here at L4, 5. Okay, now there's probably going to be a hinge as well, L1, 2. But if you got this hinge at L4, 5, okay, think of like a plastic spoon. If you bend it once, it's probably not going to break, all right? But if you keep doing this with it, eventually you're going to create a hinge, and then you're going to create a weakened hinge, and it's going to break. So that's what's going on here, okay? And this segmental instability is usually accompanied by some segmental instability up the spine. So you might look at like maybe T8 region, C7, T1, something like that. But today we're just going to focus on the lumbar. So we've got instability going on here, and if we take a look at our anatomy picture, so what's responsible for keeping stability? Well, it's the deep intrinsic muscle groups of our spine. So basically what this means is we haven't developed the strength and stability in the lumbar, and in most cases it's to maintain flexion, okay, which is the extended position, or I'm sorry, extension, which is the extended position, and we get too weak in the extended position, so we cave into a flexed position. We go into flexion, which is like going towards the fetal position. So again, it's doing that with the plastic spoon or fork. So enough of that goes on, and you create weakness here. You create taut muscles that become long and tight and weak. And that's just a recipe for disaster. So we're walking along, we're doing our thing. Maybe we get out of bed and we do a flexion moment. We force flexion. Maybe we brush our teeth and we're hanging our ligaments as we're brushing our teeth. Then we put our shoes on, and then we have a flexion moment, which means we go from a neutral spine to a flexed spine to get our shoes on. And then we try to come back up out of it while our spine is in flexion. So these are types of things that really wear this down. It's kind of like braces, it's called creep. So it's be like, similar thing. Braces, they apply gentle pressure, right? Moving it towards a different position. So if you think about, if you're sitting down at work and you're hunched over, like really what you're doing is you're putting braces on your spine to put it into flexion. So that weakens it, lengthens it, weakens it, makes it taut, and we get instability here. So basically it's not difficult to see how instability, so imagine how this is all supposed to work together. It's supposed to flex and extend together. It's supposed to work as a unit. But if you've got a couple three that are stuck in a block chunk and you've got hypermobility above and below it, okay, you're going to create almost rattling of these vertebrae. Okay, so what happens? Well, something. Let's say you get a vertebrae that shifts a little bit or has a tendency to move along when it goes into flexion extension. All right, well, that's going to do something to the disc. You're not just going to move the vertebrae and not affect the disc, okay? Eventually, you're going to do something to this annulus or the actual position of the disc. So this disc can actually herniate out and creep into the nerve root, or it can create a bulge, okay, where this annulus layer, it gets weakened or it gets ruptured, and some of the disc fluid pops out. Think of squeezing a jelly donut. And it pops out and creeps into that nerve. And then for those of you with intermittent bouts of it, so that creeps out, and then maybe you're inactive for a few days, or maybe you just take it easy, and then that fluid creeps back into the disc, but we haven't caused the mechanism that caused it, which is poor movement strategy, possibly poor posture, and poor stability, mobility, and integrated core function here. So now we've got to the point of how we get to the sciatica, okay, what it's affecting. Now, if you see here, generally your symptoms start out localized, and then we see radiating symptoms, itching, numbness, tingling, burning, but those travel down, and generally, like right here is when we really start to notice it, when it gets in our buttocks area, which is the piriformis here, and this is where a lot of the diagnoses end, and I'm just gonna put out a disclaimer. I don't have anything against doctors. I don't have anything against chiropractors. I don't have anything against physical therapists, personal trainers. There's great practitioners in all those areas, but I'm very much opposed to those that don't utilize everything they know to help somebody get better. So some of you have been diagnosed with piriformis syndrome. Far as I can tell, piriformis syndrome is just a diagnosis that means we know you have pain in your piriformis area, and we know that it's not normal, but we're not really willing to go and give you a full assessment and figure out what the causal mechanism is or how to fix it. Okay. So if you're not getting a full assessment, if you're not getting a full functional range of motion test, you're not getting any provocative pain testing, in other words, what's causing this pain, if you're not being instructed on how to find immediate relief on your pain and how to correct the ergonomic deficiencies and how to correct this through a corrective exercise program, stretching, conditioning, strengthening program, then you haven't got an assessment. You have not got a proper diagnosis. Okay. So just going to throw that out there. So if you're not getting that and someone told you had piriformis syndrome or just sciatica and didn't give you any further instruction, you're missing a huge part of the puzzle. Okay. Huge piece of the puzzle. So what do we do to fix this? Okay. What do we do to fix this? Well, first thing you got to do is you got to check your ergonomics. You got to check how you're moving. Find out what's causing the pain. Do I get in pain when I extend, or do I get in pain when I flex? That's the first thing. Are you flexion intolerant? Are you extension intolerant? And then what is causing the onset of this? Does this come on when I lean to the side? All right. Does this come on when I twist? Does this come on when I pick something up and load my spine? Or does this come up in the morning, first thing in the morning, or maybe after a day of activity? So these are all things you really got to get in touch with. And then from there, what can I do differently ergonomically? Okay. Change my movement strategy. So what is my strategy for bending? What is my strategy for squatting? What is my strategy for getting out of bed? These are all things you need to consider. And then from there, you can determine what's causing the pain. You can determine how to get out of it. And then from there, you can really develop a corrective strategy to take care of this. So if you don't take care of these things, guys, you're talking years. I mean, upwards of 10 years if it's a really bad case. There's a lot of stuff out there saying you can fix this stuff in 6 to 12 weeks. You can in minor cases, but some of them have just gone on too long to be fixed in that amount of time. So just remember, if there's anything that you take away from this, it's that Okay, your spine needs to be protected by these muscle groups, and it needs to be protected by the deep intrinsic muscle groups. Now, you can create stability in the spine with the outer unit muscles, and that's great for avoiding injury. That's great for getting out of pain. But what it doesn't do is allow you to thrive. By focusing on this deep inner unit muscles, you can lay the foundation to build something big and strong on top of it. Okay, so one method, Dr. Stuart McGill's method, as far as I can tell from what I've studied, he's all about providing stiffness in the spine and distal mobility, which is awesome. But sooner or later, if you have a deficiency in integration with this inner unit spine, you've got to address that. You've got to correct it. As opposed to Paul Chek, who is my mentor, and he's all about the deep inner unit muscles, and he's all about stability and stiffness in the spine as well. But the difference between these two practitioners is one really focuses on the deep inner unit. One is more about global stability and just protecting the spine. They both have their uses and are very functional in the right setting. So we have to look at this, the deep inner unit muscles of the spine in the front and the back. So you need to make sure that you get on a program that strengthens those greatly after you determine your pain triggers. And really, guys, just take it easy. If you're feeling pain, tightness, stiffness in the back, and you've got a softball game or something, you're just going to have to call in for it if you want this to get better. Now, granted, there are a lot of other things to consider. This is slightly out of context, but we do what we can in a 10-15 minute video. But if this is something that's resonated with you, these are the types of things that we really focus on, you guys. So if you'd like it, take a look at what's going on in your core and your spine, right? How is this any different than what's going on in like our mental, emotional, spiritual bodies? There isn't a whole lot different, right? We've got to work from the inside out. We've got to take care of the deep inner seeds before we worry about the external. It's the exact same thing with your body. So if these types of concepts are something that are new to you, but attractive, something that seems like it makes a lot of sense, even though you haven't heard it a lot, okay? There's a reason for that, right? The way we focus on fixing people is root cause. And the thing about root cause is it's not super profitable in the long term, because we can fix you and we can teach you how to fix yourself. And then you're not coming and seeing us again, once a month or once every 3 months or whatever. And that's what the medical model is doing right now, which is why you've been seen several times and not been fixed. So the guy who's responsible for like hip, pelvis and all that, he doesn't want to touch like nerve innervation or organ function or anything like that. So, and that's another thing I forgot to mention as well. One other caveat, another thing that can shut down these inner unit muscles is improper organ function. So the most common cause of that would be food allergies, food intolerances. And so if you've got a gluten intolerance or dairy intolerance, you're eating gluten and dairy, that's going to inflame these inner unit muscles through the organs, because the organs and the muscles are innervated. The organs use the muscles as a nerve delivery system. In other words, that they use the muscles to let the body know that the organs are in pain. So if you've got an inflamed organ, liver, kidneys, intestinal tract, all right, all that's going to inflame and it's going to shut down this inner unit. You've got your pelvic floor down here. You've got your transverse abdominis, diaphragm pushes down, internal obliques, all that, but your inner unit's going to be shut down because of inflammation. So it's going to cause muscle inhibition. So that's another thing to think about. Your diet does affect your back pain. Okay. So, but anyway, if this information is something that you find, intriguing and titillating, and it makes sense to you, I encourage you to reach out to us and at least follow us around, because this is what we're focusing on. This is the truth we're trying to deliver here. But also I've put together an awesome guide. It's called the Body Mind Biohacking Guide. And really it's a holistic guide, and it talks about these concepts, tying things in. We're a system of systems, we're a synergistic organism, and things like this are really the way we've got to look at our health. And so this guide has got all of our 5 fundamental pillars of health. And by going through this, you'll be able to quantify where you might be out of balance, and you might not realize that your diet is tying into your back pain. And so as you go through the physical portion of the exercises, you might find some benefit there, but then boy, you might find increased benefit as you go through the diet portion of the guide, and getting a lot of great feedback. People are really discovering where they're out of balance. And once you figure out where you're at, and if you know where you want to be, then that makes the hope and the promise of achieving success and proper rehabilitation and lifelong fulfillment go way up. So if that's something you're interested in, go to biohackingtruth.com/guide and just sign up for it. It's a free resource, no commitment. All right, guys, I appreciate you sticking along and listen to what I have to say. I hope if you have sciatica symptoms, some of this is new to you, and you might be able to find relief. If you still have more questions, leave them in the comments below, or you can reach out to me direct, Jerry@biohackingtruth.com. So again, appreciate everything you guys do. Take care, much love, live well, peace.